denied the surgery. And so my doctor, being the wonderful doctor that she is, contacted their medical officer, who's a physician herself, and talked to her personally about my needs, and it was still denied.
So she's 60 years old, 5 years short of Medicare, has sought various insurance companies for coverage and can't get it. So that's just really astonishing, appalling to me that in this country, when you're self-made, when you've worked so hard, that you can't get yourself insurance when you really, really need it. She's been trying for years.
It's a popular misconception to tell the public that it's a complicated system and we've got to try and work it out together and figure out some consensus. It's not that complicated, guys. The rest of the developed world is already doing it. So this whole notion that, gosh, let's kind of go back to the laboratory and play with a bunch of test tubes and see if we can figure it out. They're already doing it. France is doing it, Sweden's doing it, Germany. Everybody but us is doing it, meaning covering all citizens with the same care for half as much money. It's not that complicated.
The first point is that they affirmed that the goal of health reform is to move towards a continuous, affordable, universal, sustainable, and effective health system.
Cause.
Cause.
What is cause? Well, as Dr. Kapitman said, it was based on principles made by the Institute of Medicine. Does cause satisfy cause? It is continuous. It's affordable to the individual. In full implementation, there's universal access. It's sustainable to the country because it's affordable and it's going to make patients healthier. And it's effective. And we need places like the San Joaquin Valley to get special attention through a federal matching assistance program. We have about 47 million people uninsured in the United States. About 9.5 million of them are children. So for the oldest and sickest, you have to have government because a private insurance could not stay in business and pay those kinds of costs unless they charged a premium that no one could afford. What that means is that people who do not want reform because they don't want to lose their health care will lose their health care because nobody's talking about the impending insolvency of Medicare. The phases pass, more people get covered. But in the first phase, people aged 18 to 64 have an option to buy a Medicare-based public plan. Taking my son to college, and I told him, you think for yourself. Don't be led. If the cause is worth, join it, but never be led. This is the cause to believe in.
Like the doctor, if I get emotional, this is not just about whether or not we have affordable health care. Any reform policy has to address communities of people whose environment does not enable them to adopt and maintain healthy lifestyles.
Once you get sick, they will find any opportunity they can to then take away your benefits. So we really are fighting for some strong consumer protections and regulation of the insurance industry that is included in all of the bills that are being presented. Having been a victim of domestic violence is considered a pre-existing condition. Some folks at an insurance company sat down and had a little discussion, took out their calculators, I'm sure, and just calculated that, if this woman was beaten before, she's likely to be beaten again, which means, she might have to go to the hospital, she might have some broken bones, so, uninsurable. We want to make sure that that is not something that will ever happen again.
It's just out of control, and it's really to judge the content of a nation's character, look no further than its healthcare system. Yeah.
They affirmed the need for a strong public health access to improve access to care and provide competition to the private market. I think what's unique about the Valley and about this story is the Valley faces a real shortage of finances for our healthcare system. We are an underfunded system.
And really the San Joaquin Valley, let's face it, there was a study out last year that compares us to Appalachia. And many times we feel like we're the stepchild of the state, and many times we're treated that way.
A chance to lead a healthy life. In terms of the undocumented issue, they are in our schools. You know, we solved that issue several years ago. Why is it different that we don't want to give them the ability to see a doctor on a regular basis? I think we're schizophrenic in that.
I get to come from a very righteous standpoint, saying, you know, we service the uninsured and the underserved. That being said, I would also like to tip my hat to the remarks we made to the need to focus on farm workers.
The hard conversation, though, is one that, if you listen to television recently, America does not want to have. We do not want to address the disparities that occur economically, culturally, racially.
I think we're at this junction where some kind of health reform will pass. How much it meets the needs of places like the Central Valley or California more broadly is yet to be seen. And so all of this work is not for naught. Mm-hmm. It's really important in terms of building the coalitions, building shared ideas, building consensus around what we want to accomplish.
They've introduced this House bill, and it just makes me feel all the more that cause is necessary.
Certainly the cause principles are very admirable, and if many of those, if not all of them, could be implemented, it'd be very beneficial for our country. The problem is doing it in such a way that could all be accepted by everybody and understood by everybody, because a lot of these principles are very complicated. The healthcare system today is very complicated. Patients in general are confused about what kind of care they can get, where they get it.
In terms of the principles of cause is the notion of adequate reimbursement. California ranks dead last in the country in reimbursement to physicians and hospitals in Medi-Cal and Medicare.
The reason that our system is in such trouble is that it is set up to deliver profits primarily and provide care secondarily.
Nobody said that this was not going to be a controversial discussion.
So anybody making a stock trade will pay into this.
But the beauty of it is that investors that tend to invest and hold aren't hit by this tax very much. It's the speculators. It's the people that are churning their investments and speculate on oil's futures and things like this.
Will pay for health care.
That will pay for health care.
Is it possible to think about moving in California toward a universal system? What are some of the issues around that?
I do not believe, though, a single-payer bill in California is viable, because California can't even pass a budget. And I would loathe to think, if they were in charge of health care now in this environment, how it would ever be financed.
The young and the healthy subsidize the older and the sick in exchange for guaranteed access to health care when they need it, because we're all going to get old and we're all going to get sick. And that's the principle of social insurance, and in my view it ought to apply in health care as well.
Divergent perspectives, even as there was this element of real consensus on the idea that the healthcare system needs to follow something like these cause principles. And for me, that consensus was really the most exciting thing of the day.
She came out of the surgery, but she never made it out of the hospital because she was not insured. Because she was not insured, I don't think the care in the hospital was as well as it should have been.
They stayed in those jobs mainly because that was the only way that they could have health insurance, and that we could have health insurance growing up as children.
The question is, where do we go next? How do we get there? And I think the discussion today showed that there is a tremendous amount of consensus.